So my name is Tara Miller, and I'm a registered clinical counselor and psychotherapist. I work primarily with trauma. And in my practice, I use a modality called self-regulation therapy, also known as SRT, and I use it exclusively for everything. But I work primarily with trauma-related conditions, including chronic pain, PTSD, and more. It is a neuroscience-based approach to regulating the nervous system, or basically using the mind and body to heal trauma where it's held in the brain. And that's one of the problems with how trauma used to be seen and how chronic pain used to be seen, is that it used to be seen as something that was wrong in the body. And now we know that actually the trauma is held in the brain, and so is the pain pathways. They get overactivated and lit up for too long, and then they kind of get stuck in this really hypersensitive receiving mode to pain that changes the brain. And so we can make progress with trauma and chronic pain conditions, knowing what we know about the nervous system based on this science that tells us that really we need to be treating the body as well as the brain, and how the two are connected. And if you forget one, if you miss treating one of them, you're really not going to get the potential for healing that you could. Now, I work and have been trained by the Canadian Foundation for Trauma Research and Education. I also help them train other therapists and even body workers in SRT, and doctors and nurses as well. And I'm part of their research board. I work very collaboratively in my practice because we know that people that get collaborative care do better, they heal faster, they feel more supported. And so I have a referring network of professionals. Often my clients will see me for psychotherapy and regulating their nervous system, and then they'll also see this amazing acupuncturist I know for one, traditional Chinese medicine, possibly a naturopath, a chiropractor, massage therapist, homeopath. So there's multiple modalities that can work together to really provide optimal healing environments for somebody that has chronic pain. So SRT uses a neurobiological approach to healing chronic pain. Clients experience a reduction in emotional mental symptoms because of the work that we've done. They typically experience a reduction in actual reported pain levels. They experience a greater sense of resiliency, control, and ability to regulate their moods. And then once we have people regulated, where they're in this place where they have a reduction of symptoms, we have a sense of feeling a little more like themselves, a little better, we have shown more improvements. This is the place where clients are able to then start adopting cognitive behavioral coping strategies to manage stress and to start reclaiming their lives. Prior to this point, a lot of the CBT work, the cognitive behavioral stuff, is really hard to integrate because you're dealing with a nervous system that is really stuck in a different state. It's a state that makes it hard to learn, makes it hard to change behavior. It's too activated, it's too lit up. And so these strategies, while they're great and very helpful, are best to have come on board after you've done some work to have your entire nervous system, which is your mind and body, connected at a calmer, more baseline, healthier place. And then again, with this, many have reductions in their pain medications, reductions in their psychoactive prescriptions, and report an improvement in overall functioning and quality of life. And so I've seen this directly in my own clients with years of work with car accidents, major falls, near-death experiences, medical trauma, and lots of chronic pain that's resulted as part of this. And going through this process and this kind of healing modality, a lot of people have really been able to manage their symptoms more naturally, more holistically, and have more better reported improvement in how they feel about their life and how they have hope about regaining continued functioning later. So treating chronic pain with self-regulation therapy, those are the benefits of. This is why we do it, but it really also agrees with the science that says that chronic pain is a nervous system disorder. And we know that with all the research that's coming out, it's held in the brain, it's a nervous system disorder, it's not just in the body, it's also not just in your head. So here's what we know. We know it's not all in your head, but sometimes it feels that way. And Often, really old school medical community approaches and professionals make you feel like it's all in your head. They don't really know how to treat it other than with painkillers or antidepressants or an arsenal of pharmaceutical support, but they don't really know how to support you, and they don't really have an understanding, especially general practitioners. They can't know everything. They can't be up on all of the research on everything. And what we know is that they tend to fall short in the newest research on what they know about mental health, things like nutrition, and certainly with chronic pain. So they misunderstand. What we do know is that pain does change your brain. So it's not all in your head, but it certainly is going to change your brain. It changes the way it's wired up. It changes the way it exists in a resting state, if you can even find that. And it changes the structure of your brain, shrinking some areas and making some areas even bigger, more sensitized. So chronic pain is a nervous system disease more than it is a physical condition. We also know that some people develop chronic pain, obviously, and others don't. Given the same amount of trauma or the same experience, we have some ideas why, but we do know that some people are more predisposed or more set up to develop a chronic pain condition versus others. What we know about the nervous system gives us increasingly effective ways to treat chronic pain as well as its emotional and mental symptoms. So the nervous system is your container. Your nervous system is what you live in, not just your physical body. We know the mind and the body are connected. If you think of your nervous system like a glass that fills with water over the course of your life. And so in the beginning, depending on what your mom's pregnancy was like, what your labor and delivery was like, that's where activation or the filling of this cup begins, second trimester and beyond. And so what's really important is then what happened after you were born. What was your attachment with your mother like? What was your health like as a baby? Did you have failure to thrive? Did you have jaundice or fever or seizures or medical conditions? These will increase the water in your container right off the bat and set you up to be not for sure to get any kind of condition, but for sure to be predisposed to conditions like anxiety, depression, chronic pain, and some psychosomatic issues like migraine headaches, insomnia, gastrointestinal issues. A lot of that is related to your nervous system filling up. So you start off as a baby. Your size and shape of container is impacted by prenatal experience, by genetics, by your temperament. So these are all things that you can't control, but you get what you get. And then over time, whatever your experiences are in life, if you have traumas, if your parents go through a divorce and that was difficult for you, if you hit your head and had multiple concussions, other accidents, all of these will start to fill your container. So when your container's here, glass number 2, things can happen in your life and you've got all this room to deal with them. No problem. It might stress you out, but you can kind of always come back to feeling like you're in control and having a grip on things. The more your container fills up, you have less room. And then up here you have this full container. Well, the next step is that you have enough trauma. You only need one minor fender bender at this point. You might have dealt with the worst of the worst that people have heard in your life to fill your container up this far, but then you fall off a curb or somebody rear ends you and all of a sudden this container can't take anymore, overflows. The overflowing of this container is where we see symptoms. This is anxiety, depression, things that don't go away, chronic states. It is an overflowing of the container. The resiliency is completely depleted. And so SRT really works with this analogy to skim layers off the top, starting in this moment, in the here and now, and building resilience by removing these layers in a very specific mind-body connected way. What we know is that the nervous system always wins. So there's no shame here because if your cup is overflowing, your nervous system is going to take over. Its job is survival. And so it doesn't matter how smart you are, how disciplined you are, your brain is going to be driven by your animal brain, your nervous system, and it will always win. So you can't outthink your own thoughts. You can't control every thought and feeling and hope that it's going to change your pain, it's going to improve your resilience. The nervous system's in control. It always wins. It's like any other mammals. Its job is survival, and that's what it does. And so, like any other animal, You begin at a baseline of calm or neutral. You know, you're a deer chewing on grass in the field. And you have a survival instinct that responds to threat. So until you hear or notice that there's a threat, you are pretty much in this calm, neutral state. When there is a threat, whether it's real or imaginary, you have a response. Your brain will initiate a survival response that comes into your conscious brain later. So you think you know what's happening in the moment, but actually your survival brain has already picked up on sights, smells, sounds, and started a chemical reaction to help you survive, scanning the situation and assessing which of these is your best case for survival: fight, flight, or freeze. This isn't conscious. This is your survival brain saying, this is what I've decided in this situation is best for your survival. So fight, flight, or freeze when faced with threat or overwhelm. So trauma isn't just what we classify as trauma with these big, awful experiences. Trauma really can be anything that overwhelms the nervous system, especially if you have a full cup. So as an animal, after the threat or incident has passed, you've fought and killed the threat, and now you're safe. You've run away in flight, and now you're safe, or you've frozen, and the predator went off because they thought you were dead. Either way, you've come back to safety. The incident has passed. In a healthy nervous system, you will return back to your baseline, back to your calm or neutral. The problem is when this process gets interrupted, you can get stuck. You can get stuck in this high state of arousal, which we call sympathetic arousal. It's the sympathetic nervous system that's supposed to protect you. If you get stuck here, you're pumping out all these survival chemicals in the brain. Your blood flow is changed. Your heart rate, your respiration, all that has changed. Your digestive system has slowed down. And there's a cascade of all these events to help you survive. Now, when you get stuck here, it really starts to deplete the efficiency of your immune system, of your organs. This is why we see so many gastrointestinal issues after trauma, because really the blood flow for survival is around anything but digestion. Many animals will throw up and excrete anything that's in their gut so that they can get away faster. So it explains why gut problems are so prominent. So when this happens, when you get stuck, your brain stays kindled. It stays charged up. It's like holding an electrical charge. It's still releasing fight or flight chemicals like cortisol and endorphins, which are really, really stressful for your entire body and for your mind. So this will create a compromised state, impairing the body's ability to heal. It will also keep this charge in your brain that gets stuck there and forgets to go back down to baseline to say that the pain is gone, that the threat is over, that you've healed. So it's a little bit of this brain confusion of coming back down to baseline. It gets interrupted. And here you can see, we've all seen things like this. You can fight, I'm out of here. That one that's often missed though is freeze. And it's very common because if we can't fight our attacker, if we can't run away, we will just freeze. And the immobility is assessed from the brain as being the best chance for survival. So you hear a lot of women that have been attacked go into freeze mode because their system has decided that that's their best option for survival. It works for bears too. So one of the common denominators in chronic pain is a history of trauma. And like we said, depending on your nervous system and what's already in the cup, trauma is always about what's already in your cup versus you can't base symptoms or prognosis or experience based on what the event is. You can't compare one person to another, one event to another, because it always depends on what's already in the cup. When there's an incident, when you are hurt, when you're injured, when you've been in a traumatic experience and there's an injury, the pain is acute. So when this first happens, the brain lights up in all the areas associated with sensory perception and releases chemicals, including endorphins and natural painkillers, to go to the site to help it heal. When the event is over, the nervous system, just like fight, flight, or freeze, is supposed to return to baseline. And when it doesn't, it starts to reorganize. When the pain is prolonged, it starts to reorganize, and that activation in the brain shifts to a structure called the amygdala, which is involved in emotional processing. So then the pain, which was physical, now becomes part of an emotional process. This explains why pain creates emotional symptoms as well as the physical ones. And this activation stays in the amygdala throughout the duration of chronic pain. Some of the most activating things that you can experience are pain, sickness, and lack of sleep. Those will all charge up your nervous system, increase kindling in the brain, increase this sense of heightened arousal, sympathetic arousal, and make it harder for you to heal and recover from anything in your life. Very hard to regulate any of your emotional, physical processes when you have injury, pain, lack of sleep, illness. So here's a healthy nervous system. And again, there's an event, you have sympathetic arousal in response. And again, this is normal. We're not supposed to be a flat line. Anxiety is normal, moments of depression are normal. We want them to be within this range and appropriate to the corresponding event. After the events happen, there's a settling where the parasympathetic nervous system comes online, releases supporting chemicals to bring you down, and then this is kind of our life. Just a nice flow. And then this is undischarged traumatic stress, which means there's a traumatic event, it spikes you out of the range. So you're either stuck up here or you're stuck on off down here, or you're going between the two. So it's very interesting because often people are misdiagnosed as bipolar when in fact it's really PTSD, because PTSD is this continuing of symptoms after the event, long after the event, and these cyclical spikes between high anxiety, low moments. And really when you treat the trauma and you treat the PTSD in the correct way, it really isn't bipolar at all. But you can see where if you're stuck on anxiety, panic, exaggerated startle reflexes, inability to relax, hypervigilance, you're constantly looking for threat, digestive issues, emotional issues. This is where you get the chronic pain from, rage, sleeplessness. You get stuck on the off, you're going to see the depression, the flat affect. Some people's faces don't even move when they talk anymore, coming first into session. Chronic fatigue, disconnection, dissociation, more pain syndromes, and poor digestion. So a lot of these overlap and a lot of people experience all of them. And some people are more predisposed to being kind of stuck on or kind of stuck off. If I was going to be stuck in one direction, my predisposition would probably be to be stuck on. So in addition to that, emotional symptoms contribute to pain. And so in this study here, where they found that depression is one of the strongest predictors of low back pain. So the pain didn't come first, the depression came first, and the pain came after. And again, that's because of how depression, anxiety, and pain all actually change the brain. The good news is the brain is plastic and can be changed, molded, and worked and healed for the rest of your life. It never stops. So none of this is permanent. Everything is temporary to a certain degree. And we know this because everybody has bad days and some people have days that are better than others. There is a range and a flow to it, and that can be increased and improved with what we know about neuroplasticity. But this is very interesting because increased intensity of pain also coincides with increased severity of depression. So they hold hands and they feed each other, but it's like your toxic, drama-filled, drama-loving, drama-creating friend. You might love them, but it really increases activation in your life as well as theirs, and there is this kind of toxic cycle that happens. So do emotional and mental health issues cause chronic pain, or does chronic pain cause emotional and mental health issues? And the answer is both. They both, like a bad relationship, contribute to each other. And here's just some incidents of major depression disorder coinciding with some chronic pain conditions. Chronic pain, again, it's a disease of the nervous system. After any trauma, the nervous system starts to reorganize itself. The dramatic changes that occur with injury and persistent pain underscore that chronic pain should be considered a disease of the nervous system and not just a symptom of an injury. Progression into chronic pain is more dependent, says the research, on psychosocial and occupational factors than on physical considerations, which is we need to treat it from a whole-brained approach, including all of the factors of a person's life, whole brain. Other than pain, a lot of people with chronic pain, and you're going to be familiar with some of these, experience fatigue, insomnia, trouble sleeping, nightmares, immune system dysfunction, depression, anxiety, mood variability. PTSD is very common. Digestive difficulties are huge. Allergies, autoimmune disease, very common. TMJ, extremely common. TMJ is actually related to thwarted fight. So you didn't get to fight when you needed to, and you can end up clenching in the jaw and even have pelvic issues as it relates to how the body neurobiologically is wired up to fight or flight. So you might recognize some of these and be able to check a lot of them off. You might be experiencing some of them right now. And you can also think about what kinds of things that you've used to treat them. And it's important to know what you've actually tried and what has worked and what hasn't worked. And to really have a sense of where there might be gaps, where there's new things for you to try, and knowing and being able to be your own voice and advocate for what doesn't work and what you don't believe in and the kind of treatment that you don't want, because you can get into a place where you're just desperate enough to try anything, and that's how I have stumbled on some of the best treatments. On the other hand, you can feel like your doctor's pushing everything down your throat and some things just don't feel right. So it's important to know what works for you. And again, if this is a whole system disease and approach that we need to treat it. And so back to the kindling and quenching. We talked about how kindling keeps the brain lit up. It's a term used to describe how the brain holds activation, how it's more sensitive and less resilient to future events, your full container. The kindling and chronic pain can be from any series of events at any time of life, including emotional and relationship trauma, high impact falls, motor vehicle accidents, medical procedures, previous illnesses, repeat concussions, mild traumatic brain injury, etc. This sets up your nervous system to be more predisposed to chronic pain conditions than someone without a system that's quite as kindled. This is why patients continue to report an increase or the same levels of pain despite the fact that the actual physical injury has healed and that perhaps the physical pain, if it could be measured accurately, would show to be decreasing, but it's reported by the patient as increasing. So there's an issue with perception not being quite accurate because of the disconnect here. And the longer the pain continues, the more the brain circuitry around pain is reinforced, and those neural connections around chronic pain that will hold you in a pain pathway are stronger, and they're much harder to unravel and pull apart and heal from. Not impossible, but it does take some time. And again, the pain is held in these pain pathways in the brain. So how this all fits together. We know how the nervous system is impacted by overwhelm and traumatic events. We know how trauma and overwhelm can sensitize the brain and make it more predisposed to chronic pain conditions. We know the relationship between chronic pain and emotional and mental symptoms, and how that's all connected. And we know that talking, thinking, having memories about the events, about our pain, the more we talk about it, the more it lights up the brain in the fight or flight centers all over again. And it doesn't actually create healing. If all you needed to do was talk about what happened to you or talk about what's happening to you now, you would go to your best friend or somebody you trust and you'd be cured. And we know that doesn't work. In fact, when you talk about any condition that you might have, when you own it and call it mine, my depression, my anxiety, my whatever the diagnosis is, right there it's limited into a box where it has limited the capacity of it to change, where we know that the brain can change for the course of your life for the best. But it also gives ownership to it. And it also means that then there's this singular focus where your identity becomes the diagnosis. And what we know is that the more you talk about an accident that you've had or anything negative, because our brain is wired to be more focused on the negative, and that has to do with our survival brain always looking for threat. It's looking for the worst. So when we indulge in that, when we give it the worst, when we talk about negative things, the brain lights up in all the places as it did when we first had our accident. So often people's pain gets better after their ICBC claims are over because they don't need to spend the next 4 years talking about their accident over and over and over again, reliving it, having the brain light up, and having those negative pathways, those chronic pain pathways, those injured, traumatized pathways lit up and fired up and wiring together stronger and stronger every time. So every time you talk about it, it fires up and it wires together stronger. Which is why SRT is a preferred modality for trauma work, especially because it doesn't cause you to relive the moment. It's developed out of leading edge neuroscience theories and cutting edge brain science, and it works to quench the kindling by not putting you in a state of overwhelm. Being overwhelmed just increases activation, and our job is to decrease the activation in your nervous system. So we start in this moment, and we work in a specific mind-body way to create more room in the nervous system. It is definitely not talk therapy. We do talk, but never is a client allowed to go out of range into high overwhelm, high emotionality in any way, because that puts you into a trauma vortex, and it is counterintuitive to what we're trying to do. So there's no flooding, there's no reliving, there's no reenactment. We don't tell the story as it happened each time, because that actually makes it worse. It digs those pathways deeper and makes it harder to heal from. SRT works instead with what's called the healing vortex, which is a healthy range that helps teach the nervous system how it can be a little bit activated, and then we pause, and then we work that activation out. And then through imagination, through getting into the body, into the felt sense is the language of the nervous system, of the survival brain. And we're teaching the survival brain that the threat is over. And really, that's a lot of what this is. And we help it discharge all of this extra kindling that is holding in the brain and help it return back to baseline. So when the kindling is quenched and the nervous system is more regulated, again, you're back to a half cup of water. Your resiliency naturally increases. You don't have to force it. And your symptoms naturally decrease, so you don't have to work on the symptoms. And the mental, emotional, and in many cases the physical pain decreases as well. So it's looking at nourishing the nervous system from the roots up and from the bottom of the brain, your survival brain up, as opposed to treating the symptoms, which are the leaves. We don't want to be working with the symptoms. We want to be dealing with the root. This is how I know it works. I know because of the science behind it. And I also know, based on the case studies from the creators of SRT at the Canadian Foundation for Trauma Research and Education, and I've seen it work time and time again. It's why I practice it, because it doesn't cause people to relive the worst traumas of their life. I think that's excruciating. I also used to be a chronic pain sufferer. I was diagnosed with fibromyalgia at age 19. After multiple surgeries as a kid and a couple of car accidents and other events of life that I had before I was 20, they diagnosed me with a chronic pain disorder, and that was 20 years before other people were being diagnosed with fibromyalgia, so it was very unusual, but they didn't really understand it, and neither did I. So they medicated me in the way that they know how to medicate, and they told me that my life would be just balancing chronic pain and trying to be functional as a young woman in the prime of my life, which I thought was then at 20, which I now know is 40. And really feeling the limitation of that label. And I used to say, oh, I can't do that because my fibromyalgia, that will make my fibromyalgia worse. And I really owned this label. And it was the worst thing I could have done, because I no longer have fibromyalgia, and I haven't for well over a decade. And it's because of SRT and the work that I did after a car accident, where that was the last thing that I had the spillover, where I was no longer able to cope with the events of my life very well. I had a car accident, and then I had another one 6 months later. Then my ex-husband committed suicide, and then they thought my 3-year-old son had cancer, and then I had a life-threatening infection. And all of this happened within a year, and I started to see somebody, thank God, that did SRT. And out of all those things, I didn't develop insomnia. I had my IBS eliminated. My fibromyalgia went away. I no longer have asthma, and I was treated with corticosteroids for 35 years as an asthma sufferer, and I don't have it anymore. I don't have allergies anymore. I've never been healthier. I sleep like a baby. I haven't had a prescription in 8 years. And had I not found this way of treatment, I would have been stuck in a chronic pain situation that would have been lifelong, and they probably would have expected it into my 40s getting worse. This is how I know it works. This is why I'm passionate about it, why I do what I do. And so there's a couple of resources that you must read. And everybody should. The Brain's Way of Healing by Norman Doidge is absolutely so full of hope for people suffering from chronic pain. If all you did is read the first 1/3 of that book on chronic pain, you would feel differently about your current situation and what you're dealing with also. I listened to it on Audible in the car, and I just couldn't get enough of it. It's amazing, and it's full of science-backed approaches and protocols to helping not just treat but heal chronic pain. The other one that's excellent is Suggestible You. It's also one I'm listening to on Audible. And another one by Norman Doidge is The Brain That Changes Itself. So the more information that you can get on your own brain and how chronic pain works with the brain, in the sense that the new research and the new materials coming out are showing you that there's ways that this can get better for you, this is going to help you more than a lot of the other things that we're drawn to read when we are suffering from a condition. When we make our lives all about it because we're so limited by the condition, and it's hard not to think of pain when it's there all the time. In fact, it's impossible because you're activated every single day by one of the most activating things there is. So all this to be said is that there are new advances in research and ways that we know that you can heal or at least reduce the suffering that you're experiencing in chronic pain, and in some cases heal completely. If nothing else, there's ways to improve the quality of your life so this doesn't feel like an endless burden that will never get better, or that is completely permanent. Some conditions are completely permanent, but we know that when we work in this way, we can help make improvements. So there are ways to have this not be as bad as it is now, and certainly not as bad as it ever was. And we can help it not get worse. So with that, that's the end of my my talk today, and I'm available to take questions. And if this had to be recorded, then I'm taking questions via email. You can email me here at tara@westkelownacounseling.com. I practice out of Kelowna, and I'm happy to answer questions at any time.